All right, so this is James with the GVU MSAT Gen Med part 2 of my patient case. Ryan is going to stand in for my my patient case for this one today. So he is filling in the role of the ice skater this is about. So you just got your diagnosis back from the doctor the other day, and red S, so relative energy deficiency disorder. Have you heard of that before? Did the doctor tell you about it at all? They just kind of give you the DX and get you out of there?
Yeah, I forgot everything.
Yeah, okay. So essentially what it is it's a disorder that's characterized by essentially like kind of like low calorie amount in your body. It's like low energy, low nutrients, and then usually kind of goes along with disordered eating, either disordered eating on purpose or disordered eating and you just like aren't aware that you're eating disorderly. So really like couple of things that it can do. So some of the big things is like loss of periods, which is known as amenorrhea, such as lack of menstruation, or it can also cause dysmenorrhea, which is never starting your period. So they're kind of the same thing, but it's just kind of like one you started, one you haven't started. Poor reproductive health just in general. Decline performance. So as an athlete, you know, we're a really good figure skater, and like all this is going to do is like just we're not gonna be able to skate as well as we should want to be, especially for like the level we compete at. Some other things like low bone mineral density, so that can cause things like stress fractures, just like chronic, just like bone pain, stuff like that. Also like lower muscle mass, so like reduced power output. You can't support your weight as well. Again, more susceptible to injuries there. And then it also kind of impairs our judgment and decision making as well as our cognitive skills. So like away from like the athletic side of things can also affect like our social life, our school life. Like we're 16, we're in high school, like college is just a few years away. So it's like this is going to affect those other things like outside of your sport. So some of the strategies that we can kind of like put in place now is kind of get you in touch with nutritional counseling to kind of like stay on top, like make sure we're eating the things we need to, that we're not like we're avoiding habits that can lead to disordered eating. We can also kind of like watch our weight a little bit, although I would recommend we try and stay away from that as much as we can, because that can cause other issues with, you know, body image, other disordered eating stuff. So, but getting with the counselor and just kind of like knowing what your body needs to actually like fuel us going forward will help us a lot. And like a lot of that weight that we don't have right now will just kind of come back as we get on that nutritional plan. Some of the warning signs, like the possibility is there that this could like start getting worse if we don't take the right steps going forward. So if you start noticing things like hair loss, if you start losing just a ton of weight, just like super fast, and like you're not really sure why, or it's just like just a lot of weight all at once. Chills, like you can't seem to stay warm at all, even if you're bundled up. Dehydration, always thirsty, you're not getting enough water no matter what you do. Chronic injuries, so I know we have a little bit of a thing going on with our foot at the moment, with our ankle, but if we keep like we get this healed and we keep training, just like things keep popping up, maybe we need to take a step back and kind of reevaluate kind of where we're at. And then last thing on that kind of warning signs is like dental issues, like teeth, gums, gum disease, things like that. Those start becoming more and more prevalent. That's another warning sign we want to look out for. So my role kind of in your care team right now is like, I'm going to be your first line of contact if something happens. If you start noticing these warning signs, or if you have questions that maybe you don't think of today, like I'm going to be like your first line of contact. I'm also able to like put you in touch with these like other resources. So like nutritional counseling, mental health counseling, I'm directly in contact with the physician that you saw, and I can also reach out to other physicians or that your primary care physician to kind of help outreach to other care providers if we need to like grow the team a little bit more, along with like other services like here at the school, so like disability services if we need those, counseling services, things like that. So that's a lot of information all at once. Any questions, comments, concerns? just kind of like right now.
So you said I should be watching my weight, like getting on a scale and stuff, like that would be smart to do?
I would say no. What I would recommend is go see like a nutritional counselor first. Just like kind of ignore the scale, let them worry about the scale if they want to.
Mm-hmm.
But I think we kind of avoid the scale and we just kind of make sure we're eating the things we need to. Because all the scale's going to do is give you another number to worry about when we probably already kind of have to worry about like calorie intake and all these other things. So and it's like the scale, like you might step on the scale one day and it's not what you want to see. Like all that's going to do is affect you probably maybe in a negative way. So it's probably best to just kind of stay away from it and just kind of work with the professionals and kind of let them handle and then just kind of do what you got to do in that sense. Does that make sense?
Yes, that
Okay.
does. Thank you.
Okay. Anything else?
No.
All right, perfect. Again, feel free, you have my contact information. Go and get in touch if any other questions, comments, concerns come up, or if your parents have anything, just shoot me an email, have them call me, and I will be happy to either answer the question or point them in the direction if I can't. All right, thank you.